Welcome back, Smile Mentor family. Today is a little bit of a nerve-wracking day for me, but a fun day nonetheless. I mean, highly educational for you guys. We were blessed to have Dr. Ratana and Dr. Iskander, who performed the surgery and the conversion, the prosthodontist piece of it. Even though they're both surgical prosthodontists and could have done the entire surgery beginning to end, of which I've actually seen Dr. Iskander do, they worked as a tag team on this. And so what we wanted to do, because Dr. Ratana has a patient before too long, and today's a work day, we wanted to get his position and help understand from once the baton is handed off, if you will, to Dr. Ratana from Dr. Iskander. In this specific case, sometimes it's reverse, but in this case, we wanted to start with Dr. Ratana on that. And so, gentlemen, thank you.
Thank you.
Good morning. Dr. Iskander, even though we're starting with Dr. Ratana, share with me at what point does a baton handing off, right? You hand the torch, you have done several hours at this point, and now it's Dr. Ratana's time to come in. We're about at that point where he's going to be coming in. Help share with me what you're finishing up to then now know to call Dr. Ratana in.
When I finish the surgery, which is the extraction part, the implant placement part, the abutments, angulation, all this kind of finishing status of the surgery, suturing up, then Dr. Ratana take over and start doing the let's say the calibration and the alignment of the upper and the lower arches and the impressions and the prosthetic, aesthetic, functional part after the surgery.
Okay.
So surgery is done, and now we are ready to prepare for the second day delivery or the temporary, long-term, provisional. This is the part that he's taking over.
Okay. So right now I saw you ratcheting. Are you just tightening up abutments?
Yes.
Or okay.
This is after we place the implant, we put the abutment, which is like the middle piece between the implant and the prosthesis. This is what I'm doing here right now. And now I'm suturing, I believe. Yeah.
Okay. Are you suturing right now? Did you suture on this or did Dr. Iskander?
We do it both ways, so I don't know exactly in this case, so we need to check, but I think he's almost done with the abutment selection, abutment placement, and then sometimes he graft at this point. So maybe you may be grafting a little bit in some spots.
Sometimes I take advantage of him and I finish it like, you
Exactly.
Let him. And so now we have Dr. Ratana. How did you know it was your time? Does Dr. Iskander let you know?
Yes, it depends in every case, you know, but sometimes I'm with a patient, so he needs to do a little bit more. But in this case, for example, I was waiting for you, so he just called me and I started immediately, yeah.
Perfect. And then, so you come in, he's getting, like he said, the abutment set that he's put the implants in. So the screw, the post goes into the jawbone. He's got that set. Now the abutment is the in-between.
Yes.
It's the connector between the implant and the prosthesis or the teeth.
Yes.
So you're putting on the abutments, and we did 6 implants, right? 5 new, 1 original. Is that correct?
used one from your existing implants, yes?
Yeah. And so you put on 6 abutments. Now, at this point, you're done with the surgery.
Yes.
And the baton is being passed over to Dr. Ratana. So Dr.
Correct.
Ratana,
And now my assistant just like placing some healing caps on top of the abutments so the gums will not collapse until he comes within a couple of minutes or so, just to get ready.
Okay. Healing caps. I've heard those. We've talked about those. Now that I've seen where they go, that's why. That's when you use them, is at that point?
Yeah, I mean, after you finish, you need to preserve the gums from closure. So you just put healing abutments just temporarily until the next step starts.
Okay. Dr. Ratana, she's putting on the healing caps right now? Or
I guess you already did.
Yes, the healing caps.
Yeah.
And I think now we're going to start with the suturing part, yeah.
So in this case, you did do the suturing. Is that correct?
Yes, sir.
You know, one of the things that people, you know, even Dr. Iskander and I talked about this. He goes, I don't know how many patients might get excited about watching a surgery But one of the reasons we're doing this is to show how complicated this is. This is not an easy deal. This is not a filling that you're going to do. You have multiple assistants. You've got an anesthesiologist in the room. You've got 2 doctors that are going about this. I mean, there's a lot going on in one of these surgeries other than one of the others. And so do you always have 2 assistants in the room with you as well, or?
Yes. Yeah, most of the cases we have 2 or 3 assistants working with us.
Okay.
Yeah.
So now you're over there gloving up and walk me through what, and I'm trying to ask Dr. Iskander how it went. That's
That's a normal part of the process. Every patient is trying to talk and trying to ask things on that.
Is that normal?
Yes, yes.
Okay, so in that process, one of the things I wanted to let our viewers know, if you're watching this, you got to be going, did that hurt? It looks like it hurt. I can tell you that I don't remember it hurting, which is the key. I went home sore, but the surgery itself, you felt some spots at points, but it really wasn't the pain. I'm a dental pain guy. I understand it. Blood pressure, 160 over 120 a lot of the times if I'm just sitting in the chair. But this actually was easier than I thought it would be, despite how it looks. So you start suturing up. What do you have to do to prepare so the abutments are in place? Walk me through what you're doing.
So basically at this point, I'm numbing a little bit more, because the local anesthetic, maybe you were having a little bit of sensation. So we just numb a little bit more.
Okay.
We have the healing caps in position, and we're going to start suturing the soft tissue and adapting that soft tissue to your abutments, to creating a very nice environment for your prosthesis. That means that we're going to move and adapt that soft tissue depending on each implant, the position of each implant.
Around the healing caps? So
Yes,
the
yes.
healing caps, you got the bone, which now the posts are inside the bone. You've got an abutment on top of the implant, and then you put a cap, basically, almost like our light cap or a lens cap type deal that goes over the abutment. Then you sew up around that healing
Kind
cap?
of, yes. Basically what we need to do, because we have different type of tissues in your mouth, okay? So we are looking for the very good quality tissue to be around the implant, because that is going to protect your implant in the long term, okay? So we need that good quality tissue. We call it keratinized tissue. So it's a very strong tissue around your implants. So at this point, I'm just trying to adapt the tissue in the different positions depending where you have the implants.
So you're taking existing tissue there, you're separating out a specific kind of tissue and
remember that you had teeth before,
Yes.
like 1 hour ago you had teeth, okay?
Yes.
So you have, the tissue is in different positions. There were, Dr. Iskander did a bone reduction. The implants were placed in different positions, not exactly where you have teeth and all that. So now we need to play a little bit with the position of the tissue, because your tissue is not at the same position that before when you had teeth. So we need to reaccommodate that. Yeah.
How many doctors would you guys say that perform this surgery understand that?
Everybody should understand that. That's like a basic stuff about this, if you're doing these kind of procedures, you should be trained for that too,
Some clinicians, or even some patients, think that implant is bone and implant and crown. The soft tissue is as important as the bone around the implant to make a successful restoration. Same importance, not just bone and soft tissue. If you put the best implant on earth, on the best bone on earth, and you didn't adjust or you didn't deal with the soft tissue, the jacket of this area correctly, you are at high risk of losing the implant, everything. It's not just
because you're
bone.
letting the back bacteria in?
Yes.
Is that kind of peri-implantitis is what is, if you don't do this part right, you have a higher risk of that?
Believe it or not, sometimes you can, some implants can be placed not in a best bone position or in not best angulation, but you have a very well established soft tissue on top, the protector. This implant will be much safer than placing in a very good bone with poor soft tissue.
Okay. So how much of that do you guys look at in your planning side of things?
I mean, everything is connected, you know.
I know.
That's part of what we try to teach to other doctors since 2006 or something like that.
Yeah.
Is that everything should be connected. Implants are not a surgical procedure. Prosthesis over implants is not just a prosthetic procedure. So everything should be connected. The patient's health, the bone, the soft tissue, the prosthesis, the occlusion, that means the bite of the patient. Everything is, it's super important. This is a multifactorial thing, you know, so you cannot manage only one or two factors. You need to manage all of them, and then trying to remove the negative factors as much as possible. So that's, every case is different, every patient is different, every patient has different tissue, different bone, different bite, different function. So you need to deal with that, and you need to understand every factor as much as possible so you can manage every case in a very predictable way.